Plus free batteries courtesy of Warren & Griffin, your local 5-star law firm.
Download the Local 3 News and Weather apps now.
Of course, we hope that you're feeling good this morning as you watch 3+U, but if you are not and you're looking for a primary care doctor, first of all, you know they are not easy to find these days who are accepting new patients, and secondly, you want someone who you can trust, so perhaps we found just the thing for you because we are out this morning at Brainerd Primary Care, newly opened last summer, talking with Katie Campos and Taylor Ruyak. Both of you are nurse practitioners. Nice to see you both.
Yes, thank you.
Thank you for pausing a bit from the patients you're seeing to talk with us, because it's true. I think a lot of people kind of slid up closer to the TV, Taylor, because it's hard to find an office accepting new patients these days.
It is, yeah. And right now, because we're new, we have openings and we can offer same-day appointments. So people are really eager to hop on those appointments, especially if they have something acute going on that maybe they have just been putting on the back burner for a little bit, but we'd love to help tackle those problems.
Well, you know, we lived in a world, and it's been very convenient the last few years, especially with COVID, with walk-in clinics. And they serve their purpose, Katie, but from the relationship building perspective, you've got to have that primary care doctor.
Yeah, we're seeing a lot of patients that are coming in after using urgent care kind of as their primary care office. There's just a lack of continuity of care. So we're seeing a lot of patients who see different providers each time they go in. It's hard to pick up where they've left off, get records. So it's really fun for us, not only to get to know our patients, but to see them just progress or improve or just be there for prevention and just stay on top of all that.
Well, let's talk about that, because as primary care, and you're nurse practitioners, you're not doctors. There is a medical doctor who oversees things here, but you two are the ones that patients are going to see when they come in. Your training, however, is very, very lengthy. Brag about yourself a little bit, Taylor.
Yeah, so I went to the University of Tennessee in Knoxville for my undergrad nursing degree. Then I practiced as a nurse primarily in the critical care setting in ICU for about 11 years. And during that time, I went back to school to get my graduate degree through the University of South Alabama in Mobile. And then I've been practicing as an NP for the past couple of years, and I really love it.
And you, Katie?
Yeah, went to Southern Adventist University here locally, started nursing back in 2010, then practiced, mainly I did oncology, med-surg, ICU, a little bit of ER, then just finally decided I wanted to go back to school. So I went back to school, graduated in 2018 from Southern again with my master's. And have been practicing primarily in the hospital for over a year now in the outpatient setting.
So you can see how varied their careers have kind of touched on all components of health. So if somebody were to come walking through your door today saying, look, I'm looking to establish a relationship with your office, but I have emphysema, you know, whatever the condition may be, you're in a position to help them.
Mm-hmm. Right. I think skills from the hospital kind of help us just determine whether the patient can be managed in-house here, or if they need to go to the ER, and then also just having resources, knowing physicians that could get them in for specialty like pulmonary or whatever the case may be.
Let's talk about the power of prevention a little bit if we can, because I know you're able to see people from all different types of insurance carriers, right? So you accept TennCare? Medicare and Medicaid, as well as private insurance. Is that correct?
That's correct.
So sometimes, though, it's been difficult for people to get appointments with doctors because they are not accepting their insurance. So health issues have gotten worse and worse and worse. Do you see that?
Mm-hmm. Yes, we do. So it's hard. It's hard just to get yourself to the doctor and take the time to take care of yourself with everyone's busy schedules, and then it makes it even more challenging when you don't have the resources in the community. So we're really happy to be able to provide that care to people with all different types of insurances.
So when someone comes in to do their first visit with you and establish that relationship, what do you think, what should they expect when they come in? What does the first visit look like?
First visit's kind of a little busier as far as like filling out paperwork, kind of getting some information. Ideally, we'd like to get records from their previous primary care office before, but a lot of times we're doing hospital follow-up. So people get admitted to the hospital, say for emphysema or COPD exacerbation, and they don't have someone to follow up with afterwards. Maybe to refill their medication, check on them after recovering from an illness. Very common. So it's nice to just have that information, get we have access to some of the hospitals around here to get records, kind of look what happened during their hospital course, and then make sure that they get the appropriate follow-up once they're done. So it can be a little more timely, but it's a lot of talking, and then of course just keeping follow-up and kind of watching them.
Well, you're both very good talkers, and I would think that helps you though in building that relationship with patients, because people kind of put a wall up. They're a little bit nervous when they come in. Most of them are, for the first time. So I'm guessing part of your training is to pull not just what's going on with them medically, but from a life perspective too.
Mm-hmm. Yeah, I think we both focus on treating the whole person and understanding that stressors in your life, that all plays into your health. So we really do try to take time to get to know our patients. And
Are you open just during the work week, or do you have weekend hours?
Currently just Monday through Friday.
Okay, that's fair.
Yeah.
They have to rest. That way they can help you when you come in. So now you know who they are. Let me show you where they are. It's Brainerd Primary Care on Brainerd Road, conveniently located. There's their phone number and website. You can call and make an appointment either with Taylor or with Katie. There is the medical doctor who oversees things, but they're going to be your two frontline faces to welcome you when you come in the door. Thank you both so much.
Thank you.
Thank you.